joined today by Muirrean Irish. Muirrean is 2 days away from her 18th birthday and has a wealth of experience from a personal place in relationship to MAID and what it is like to experience MAID grief. Muirrean is a youth advocate in the grief space who has also presented at our annual general meeting, is getting ready to go to university and join the track team, and is such a passionate, vocal youth that matters so much to have as a part of this conversation on something that I think a lot of people don't truly understand. And without further ado, is there anything I missed in introducing you, Muirrean, that you would want to say about who you are and what brought you into this universe?
Yeah, I definitely, yeah, like I lost someone really close to me to, use MAID. And excitingly, I am going to university. Like you mentioned, I'm studying neuroscience and biomedical science. I'm really interested in like the psychology behind it and like the medical side of things. But yeah, that's an exciting part of my journey.
I'm so psyched for you, and the fact that we get to talk to you right at this transformative place in your life. Um, but before we get too deep into the conversation, uh, some people might not know what MAID is. It is an acronym,
Yeah,
MAID, and is became legal in Canada in 2016. So still in the grand scheme of things, it's fairly young. And I would love for you to help explain what MAID is, and how you help to get people to understand something that's still quite a foggy subject.
yeah, for sure. MAID stands for Medical Assistance in Dying, and it is, yeah, it's fairly new. It is usually people use it when they've been diagnosed with a terminal or chronic illness, which is there's no more treatment to sustain life. And MAID is an option to have like a choice over when you die and to not having like you don't your life doesn't need to be prolonged. It needs to be to the point where like you can go when you're still living your life and you're not just like surviving through it. And I think that's the biggest thing. It's a choice. It's death with dignity. Um, and it's definitely a scary subject. It's not a easy subject to talk about or that no one has the same opinion on it. But it's a very beautiful but also very sad decision someone has to make. Yeah, MAID is just it's a choice for good ending in a good term, I think.
I think saying it's a choice for a good ending is such a beautiful way to put it. And I feel like having you describe it matters a lot because MAID came into your life in such a personal way. So I know that your grandfather chose MAID. I want to understand um, what it was like to learn about his decision, which happened at a young age when you were 14,
Yeah.
and what it was like to process that news from a personal place.
Yeah, for sure. Yeah, it happened a long time ago. It was actually during the 2020 COVID lockdown. It was very, I think at first I had no idea what it was. Kind of like heard it and stuff, and I was like, I wonder what that is. And like, so it was very, I was very not confused. I was like a bit confused because first I was like, what is this? And it's like my first thought was he's just getting someone to basically like put an ending to his life, and I thought that was like really sad and scary. But I think as I grew up, I started to understand it more. And yeah, of course it was scary to begin with, but I also learned at a young age that he actually got to have a choice on when he decided to go, and which a lot of people before 2016 that they didn't, and they had to suffer, and they were in pain, and they didn't die a dignified life. They died in a lot of suffering and a lot of horrible instances. So I started to learn the beauty and the positivity of such a hard decision, which was made.
Yeah, yeah. I think it makes sense that this thing is both scary and empowering
Yeah.
at the same time. It feels like there's this whole array of emotions that you went through. What helped you get to a place where Maid went from that kind of like, oh my gosh, this feels like such a scary choice, to feeling like it was something that allowed your grandfather to die with dignity? What helped you get to that?
I think it's a weird thing that helped, but I think seeing him and how much at first, like with pulmonary fibrosis, he was still living a life. But as the years progressed, I think it was around 7 or 6 years before he used MAID, but after the diagnosis of pulmonary fibrosis. And I think seeing him and like the pain he was in and how much he was suffering, and over the years is where his living turned into just surviving, didn't seem as scary, because what was scary was seeing the person I love so much suffer
Mm.
with like no way to stop it. And the illness became more scarier than MAID was, and MAID became more relieving than having to see someone suffer that much. And it almost became like knowing that MAID was an option made what he was dealing with less scary, and it made it that he had a choice and he didn't actually have to die, or he didn't have to be suffering then dying, that he could live and then pass away, but in a peaceful, in a way that he has control over. Yeah.
That makes so much sense. That distinction you're drawing in the fear of him, the fear of the kind of life that he was facing, living with pulmonary fibrosis, became larger than the fear of MAID itself. And I think it brings up some really interesting questions about life and death and the kind of life that's worth living. And I'm wondering if you would be able to share what your philosophy on life and death looks like after having watched your grandfather go through this and make this really intentional choice. Like, what do you think makes a life worth living?
Yeah, I really learned about the difference between living and surviving. It's a thing that I think a lot of us understand. It can be with mental health, is when you just feel like you're not living. And I think everyone's goal in life is to learn how to live, because most of us, or a lot of people in the world, are working every day and they don't have a chance to go out, stand in nature, and like take a walk or a hike or something that makes you enjoy it. And seeing him, it made me realize like the big difference is, I remember when I was younger with him and he was like super happy. He still was happy till the end. He still had this really great humor. But you really learn the difference, and you can see it when someone's really living. It means they're happy, they're enjoying life, they kind of take everything like minute by minute, but also like enjoying it. And it's when you live and not for others but for yourself. And that's the big difference. Is my grandpa, there was a point where I believe, like, I never asked him, but I think he was more sticking around for the other people in his life, and it was not always about himself anymore. So that's when it turned to like just surviving. And I think that's just the biggest thing. The difference is being able to just live a life and not have to worry about that suffering. So then you don't have to just survive every day. Yeah, it's kind of like, yeah.
That makes so much sense. I feel like it's about the way you're describing it to me. It brings into mind quality of life being really important. So it's not just about the days that we're living, it's about what are we able to do with those days? And is that giving back to us as people, right? Like, when did it stop being about him living for him? So that's a really interesting way to define surviving. Like, now you're living for others. What did it look like to process grief for somebody who is choosing MAID as an option?
Yeah.
Because it's uh, a very unique type of decision and an intentional death that I imagine comes with a lot of different emotions.
Yeah. Yeah, MAID grief was like nothing I've ever been through. I've dealt with like unexpected deaths. I've dealt with like just people of old age just passing away. But MAID is something I've never had to experience before. It came with such happiness and such joy, but also such sadness and confusion, because I don't think anyone in this world has ever, it's not in a book. You can't learn about MAID grief yet. Grief is not a step by step. It's not what you've learned about. Grief is it just depends on the person, depends on how the person is passed. But made me really just overthink and also think about what grief is like, because made me feel bad. Or like the MAID Grief, it was so confusing because I felt bad for feeling happy that someone had a choice over how they died. But
Mm-hmm.
then also when I felt happy, I felt sad because, well, how should I be happy that someone's died? So it really just was so confusing because, and I think, yeah, it's just to feel happy and feel like happy that that person has came to an ending that was both, yeah, it was a hard choice, but also very peaceful and very dignified, but also just, it's just so sad and it's just so confusing and you just don't know how to feel and if it's right to feel that way. But yeah.
Yeah. And I think you've hit on something that even if people aren't experiencing grief because of MAID, I think that this is a common experience in questioning the way that we're processing grief, questioning the way that, like, the emotions that come with someone's death, even if somebody hasn't died through choosing MAID. I think there's a lot of times where a death can bring relief because we see someone suffering, or you can feel happy or grateful for the life that someone's lived. So it can be a celebratory process, you know. And there's this myth around the 5 stages of grief that I think we all know, and it's really like ingrained in our brains that make it seem like if I'm not following this exact 5 stages, I'm somehow not I'm not grieving right. And MAID just makes it all the more clear that there is no right way to grieve.
Yeah.
And it makes me wonder, you mentioned there's no book on MAID yet, which also makes sense because it's so darn new.
Yeah.
If you could write the book on MAID, like what would be the first chapter? Like what's like the first thing you'd want people to know?
I would really want people to know that MAID is gonna make you contemplate all your feelings. Like, it's gonna be hard, it's gonna be rough, it's gonna be ups and downs, and it's okay to feel happy and feel a sense of relief, and it's also okay to be sad that that person has died. Because MAID brings those two realms of like emotions, because it is such a positive thing, but also such a hard thing.
That makes a lot of sense. And that those things can live side by side. Okay, so let's say somebody had this book in their hands that you've now written, and they have different perspectives on survival versus living and what quality of life means. How do you think that this would change the way that society as a whole might approach conversations around life and death? Like, what would that look like on a day-to-day level?
I think a lot in our healthcare system is that we're trying to make sure everyone lives to like their last drop. Like that it's like everything we need to do, every single option, like every kind of medication, every kind of treatment till that person can just live as long as they can. But I think the question is that a quality of life? Is that a living life when someone is actually suffering through the treatment that a provider is giving? And I think that's what is really important, is like it's about quality of life, and sometimes the medication, sometimes the treatment, it's not gonna make the person live longer. It will make them live longer, but they'll be surviving, and it will just be treatment after treatment and a lot of suffering. And I think that's the biggest thing, is the quality of life. And I think that's what we really need to shift in our healthcare system, is that sometimes it's okay to say, I want to stop. Like, I
Yeah.
want to
Yeah.
have a peaceful ending, and I don't want to be having to go through treatment when I know that I only have a couple years left. And I think giving patients and people and families voices to how they want their life to be very important in our healthcare system and in like socially in general.
This makes so much sense to me that this understanding would greatly impact the way that the healthcare system treats patients, right? Because we assume that living longer is the goal. But if we shift the goal to quality of life, the kinds of treatments we give patients are probably going to change dramatically and might actually end up making them a lot happier. So they might not live a longer life, but they might live a more fulfilling life. And I'm curious to know how this might have impacted this kind of connection to the healthcare system might have impacted your grandfather because he was a doctor. So he kind of got to see this from both sides, having like spent so much of his life treating patients and trying to make them feel better. because he's been able to see it from the other side too. He's been on the side of trying to like extend people's lives. Yeah. Do you
Yeah.
think that that played a role in how it felt for him to be on the other side when he was the one receiving care?
Yeah, definitely. Yeah, I think having the like kind of like the history of being a physician and a doctor, he really understood like what it's like to like be like the provider, and also focusing on like I think a big thing was quality over like quantity, you could say. That it's more about the quality and like a patient's happiness and stuff, and it's not always about prolonged treatment and prolonged like different types of therapy and stuff like that. It's I think he really focused on like the importance of like patient to physician like relationship and how you can make like someone's life actually better, and that doesn't always mean like lifespan. But I also think being a physician for him, he knew a lot of what was happening in his body. So I think that gave him a hyper awareness of what was happening, how long he had left.
Yeah.
So for him, yes, it gave some benefits, and I think it helped him like advocate for different things like near the end, like trying to like put things in the newspaper talking about different things that need to be changed. But I also think it was extremely hard for him, and I saw like it's hard to suffer and have a terminal illness, but also know exactly what's happening in your body because you've had years of being a doctor. I think that was also very tricky for him, and or extremely painful because you know what's coming, and not a lot of people can say that. But
Hmm. Hmm. Yeah, the whole ignorance is bliss does not apply in his situation, right? He's so well informed. And it sounds like that level of information empowered him to be able to make this choice where he's like, I know what's coming, and I know when it no longer makes sense for me to endure this.
yeah,
Yeah, which makes me wonder, how can we leave people well informed about like what those different stages look like? Because I think sometimes when somebody is dying, we want to cushion that blow.
yeah,
We want to say all the nice things about how they might get better or how, we don't want to talk about the ways that it's going to hurt and be hard, but maybe if we were more candid about those things, it might actually help people feel empowered to make decisions around end of life for their quality of life.
yeah.
Yeah, that's really interesting. You mentioned too that he did he put something in the newspaper?
Yeah, he lived in like not a little place, but he lived in I call it the boonies, North Saanich, but he lives in like Deep Cove area.
Yeah, yeah.
And he always put different things in like the newspaper and stuff. And I think one of them was it was about he thought that we should rename what MAID was, like the standing of what MAID's definition. I think it was medically.
Medical assistance in dying is the current one.
Yeah, and I think he wanted to just change it to medical assistance in dignified dying. I think that's what he wanted. So I just found that out recently. I was just looking him up. I was like, let's see if I can find any more details. That's very interesting, and it's that would be amazing because that is the whole point. It's a dignified dying.
Yes.
And it would release some of the like stigma towards it because a lot of people just like the name like maid's fine, but when you get down to like what it actually means, but having the dignified part would really be empowering, and it would have less like kind of controversy when you would have like exactly what it's actually doing is giving people a dignified death.
Mm-hmm.
Yeah.
Mm-hmm. I can really appreciate how just that one word adds so much and helps relieve so much stigma around this. I think in general, in society, saying the word death can feel very scary. So attaching the word dignified to it can, for people who don't know a lot about MAID, really quickly help them understand what's going on here. If someone ever wanted to look up your grandfather and see if they could find articles,
Yeah.
what name should they look for?
You can either do Ron Irish or Ronald Irish. Also, his obituary, he actually wrote it himself.
That
And
makes
it's
sense.
very funny, not funny, but it's very cool. Like he had so much control over what he was doing, and
Yes.
I don't
Yes.
think I've met a lot of people, they've read it and they're like, he wrote it himself. I've never heard of that. And I think that's true. A lot of people, it's families because usually it's unexpected or someone doesn't plan. But that's what's so cool about Maid is that he had everything planned out to the date of what he wanted, and also having something that was true to him till the end, or even having people read about something that like he's not even around to hear them say it or like hear it and stuff, but it's still his legacy lives on, and he still gets to share some bit of himself even after he's passed.
There's something so beautiful about that. In I've heard people talk about how you can't attend your own funeral. It's like the one party for you that you're not there for. But in a weird way, MAID is kind of like an exception where you get a kind of advance celebration of life. Like people know when it's coming. There's this chance to really say the final things, have those conversations that really matter, which is, again, you keep talking about choice. I think there's so much empowerment in this. Like he gets to shape what that ending looks like and what his legacy looks like through that process.
Like,
So, Rob Irish of Saanich,
yeah,
which for anyone who doesn't know is in Victoria, BC. That's such a good example. That's just one person who's chosen MAID, and I'm thinking about all the others who have had access now to this revolutionary new option
yeah,
to really carve out an ending for them that feels, like you said, dignified. Okay, so grief can be a very personal thing, and here we are talking about it together. And this isn't the first time that you've talked about it either. I know the annual general meeting that we had, you spoke up about MAID, and so you've become a youth advocate in this space. And I'm wondering what it looked like for you to go from having this grief around your grandfather's decision at 14 to now at 17 speaking up about this publicly and really advocating for MAID.
yeah. Yeah, definitely. I think there's a lot of the times in a lot of different situations, you don't a lot of hear youth talking about or advocating for things, or there's a lot of topics that I wish I could advocate for, but there's so many other voices in this world that are doing it. But with MAID, there's not a lot, and also there's not many youth that are advocating for what's needed. It's been less than a year, I think, since he's passed, which it's been hard, but it's taught me about, like, yes, the grief has been hard, it still is, but I've also learned so much, and also I've been able to have a voice and also give my grandpa a voice, and like a voice to what MAID is, and also what it's like to not be the patient that's doing MAID, but also just someone that's witnessed it.
Mm.
And I think we also don't hear a lot of the time from people that have witnessed it. And I think being a youth and being someone that's just a bystander to the whole situation is really important. And also, it's also important just to have like a voice in it, in especially in something that it's a very misunderstood. MAID is very misunderstood, and there's a lot of stigma towards it. And I think really trying to detach the stigma and try to like bring more awareness to it is what I really found important, and what I really wanted to like talk about, and also shed light into like the truth about it and like the benefits of it.
It means so much. And I would love for you to elaborate on what it means to be a youth in this space, because I think you're hitting on something big that there aren't a lot of youth voices in, especially in like a space related to grief and death and MAID. So yeah, what does that mean for you?
I think it also brings like being a youth, also being able to relate to other youth. And I think that's a big thing, is there's a big difference between being an adult and someone that's under the age of 18. People my age or kids, like, we deal with grief a lot differently. And I think a lot of times kids and youth don't have someone to be like, oh, I can relate to them. They're only like a few years older than me, or they're like the same age as me. And I think that's a very big importance in the situation around grief, because a lot of times we don't have a voice. And I think it's about time that we do, that we can shed light into what it's really like, and how it's very different than what it's like to be an adult going through grief. And also that kids, even people that are like 5 or like 6, they have like a lot of thoughts, and they understand a lot more than people really give them credit to. And I think it's also important to be truthful about what's happening, because kids will pick up on it if you say it or not. But it's important to bring them into the conversation, because no matter how young or old someone is, everyone has a voice. Everyone deserves to be heard, especially in situations in grief, and then thoughts around dying, and like, how that is, and like the grief around losing someone.
Heck yes. Yeah, because I think when we exclude youth from the conversation, what we're also doing is excluding them from the opportunity to like, grieve properly,
Yeah.
to be really involved in a process with a loved one that matters to them.
Yeah.
So I can see exactly what you're saying. And I'm really glad that you are one of those youth in the conversation. because we need you in this space. And now, as you're getting ready for a new chapter in your life, about to go off and just learn so much through university, through the track team, and I would say probably really live your life. Like, what are you keeping with you from this experience with like grieving your grandfather, experiencing MAID through his decision? Um, how does it impact the way that you want to live your life in this next chapter?
Yeah, I really wanna live my life. Like I've talked about a lot about surviving and living. And I really want to learn how to live. Like I think a lot of us struggle with that, and I think losing someone like that, and yes, he was up in the ages. He was lucky to live that long as well. I think just really realizing how precious life is and that we have one shot. We have one opportunity to make the most of a world, a life, a place that yeah, some days it's going to really suck, but also just learning how to like take time for yourself. And I think that's the biggest thing for my new chapters, just like learning to just be me and not like change for anyone else, and also learning how to be welcoming. I am welcoming, but like learning how to open myself up even more and like just find people that really relate to me or just positive people in my life. I think that's really important for my next chapter, and just starting to live life and no longer just trying to survive.
It makes so much sense. I'm so excited for you, and I feel like this is the perfect place to end it when you're on the precipice of this new journey. So, thank you for taking the time to talk with us.